If you've been dealing with tennis elbow that keeps coming back, then this video is for you. In the next few minutes, I'm going to explain what causes tennis elbow, what most people miss that keeps stressing the elbow, and 2 exercises that I commonly use when I see this in practice. If you don't know who I am, my name is Dr. Matt Moreno. I'm a sports chiropractor with years of experience working in professional sports. Everything I share is based off what I've actually seen help my patients get out of pain and move better. Tennis elbow is basically an overload problem. These tendons on the back of the forearm here are your extensor tendons for the fingers and the wrist. They help bring the wrist and the fingers back like this, and they all insert right over here on the elbow. This can happen because we use them chronically too much in the same repetitive ranges of motion, and we don't give them a chance to rest or fully lengthen and contract. Something like typing or gripping on a regular basis. Or it's when they're pushed way past their limits, like when we do a new activity, something like tennis or pickleball. It's a common problem that we see. Now, most people, when they treat tennis elbow, treat just the elbow and these tendons. And that's fine. I actually don't hate that. They need to be addressed. Those are part of the problem. But if you continue to have tennis elbow and it doesn't seem to go away, even with treatment, then that's a sign that there's something else going on outside the elbow that we need to address. If you follow my work, you know that I like the idea of joints have jobs to do. Because if a joint doesn't do its job properly, it will become overloaded, or it's going to move that stress somewhere else in the body and overload another joint that's not meant to do that job. For tennis elbow specifically, one of the joints that commonly gives us trouble is actually the shoulder. If the shoulder, specifically from a stability standpoint, is not doing its job, then the wrist and extensor muscles have to overcompensate to keep up with demands being placed on it. So every time you're grabbing something, every time you're swinging your pickleball paddle or tennis racket, the wrist has to work a little bit extra hard because the shoulder isn't keeping up with what it's supposed to do, and this is trying to take up the slack. Now, this isn't true for everybody, but this is a very common compensation that we see in the office, and it's one that we like to treat when we see recurring elbow problems in people. So with that in mind, here are 2 exercises that I like to start with when someone comes in with tennis elbow and a shoulder that may be compensating. First exercise here is wrist isometric extensions, okay? So with these, the idea is we're going to pull the fingers and the wrist back and squeeze these muscles nice and hard. Depending on how bad your tendonitis is, you may not be able to squeeze very hard at first, and that's okay. These are actually meant to be kind of palliative and help decrease pain over time, but you want to push up to the pain, maybe like a 3 out of 10. You should notice that as you do them, they slowly start to get a little bit better and better each time. Okay. Ideally, we want to work up to 3 sets of 30 seconds, but starting at 3 sets of 5 seconds with less intensity and building up over the next few weeks is a good way to go about it. Okay. You should feel a nice, good squeeze through here. We don't want too much intensity at the elbow itself. If you feel some, that's okay, but most of it should be felt throughout here. And then I always like to do a before and after test. If it was previously painful to pick up a cup or move it in a certain way, you can test after we do that to see how effective the exercise is. Again, 3 sets of 30 seconds is the goal, doing that over the course of 2 to 4 weeks, and then we would even progress into some other exercises depending on how bad it is, but this is a great starting point. The other exercise that I like to do is for the shoulder. Now this is shoulder external rotation. So with this one, this is one of our foundational stability exercises for the shoulder, and you see this one get a lot of hate because it's kind of basic and it doesn't carry over a ton, but the research does show if we can build up this baseline strength in the shoulder, that it does decrease some activity in the forearm extensors and help with this long term. So one way to do this, we'll do isometrics for this too, for those of you that don't have a band. So we're going to put our arm right next to our side, okay? And ideally, you want to squeeze that elbow into your side. You can bunch up your shirt to get it to squeeze like that, or you can put a towel under here, or even your hand, and just get a good squeeze, okay? And then from here, we're going to basically push our elbow out to the side and squeeze that nice and hard. And same thing as the wrist extension. We're going to hold this for 3 sets of 30 seconds, okay? If that's too difficult for you, okay, you can, again, do 3 sets of 5 seconds, 3 sets of 10 seconds. You may notice that your shoulder cramps when doing this. Very normal, just a sign that we need to work on this a little bit. Okay. And this can be a little bit sensitive. This is working the infraspinatus on the back of the shoulder, which is common to give people trigger points or pain. Working through this will actually help prevent those, but it may be a little sensitive at first. So if you notice that you're getting some pain on the front of the shoulder or maybe even on the back of the shoulder doing this, it's a sign that you may need to look at some tissue quality there. But okay. Again, 3 sets of 30 seconds is kind of our goal, getting a nice good squeeze, and we should feel that squeeze in the back of the shoulder there. Okay. I hope this was helpful for you. If you have any questions, always feel free to reach out. And if you did like this video, please like and subscribe. It helps a ton.